host-microbe interactions, and epidemiology. Animal and environmental reservoirs. Animal reservoirs, of course, are animals that carry diseases that can be transmitted from them to humans. A specific word that means just that is zoonoses, diseases transmitted from animals to humans, such as rabies. Environmental reservoirs would be soil, water, and any other type of material that would be considered an environmental source. Clostridium tetani is an organism that causes tetanus that we can find in soil. Water, drinking water respectively, can be also a source of Salmonella typhi. Both organisms are pathogenic. They make you sick. And it just happens that soil and water would be considered, of course, non-living environmental sources or reservoirs for these two pathogens. Vectors. Vectors are insects that can transmit disease. There are two categories of vectors: biological vectors and mechanical vectors. Biological vectors are biting insects: fleas, ticks, mosquitoes, lice, all types of insects that require a blood meal and in the process of biting somehow transfer disease organisms from them to you. Mechanical vectors are insects that don't bite necessarily to transfer a disease organism to you, but instead they carry the pathogens or potential pathogens on their feet, their body, wings, on any other outward or external surface, such as a fly or an ant. Modes of transmission. Modes of transmission include contact transmission, which can be direct, indirect, or by droplets. Direct contact can be horizontal, person to person, or vertical, from mother to child during pregnancy. Direct contact means somehow our skin or mucous membranes have come in contact with another person. Again, horizontal, for contact with a person, it could be essentially a sexually transmitted disease. Someone has a pathogen on their hand and transfers it to you during a handshake. And of course, from mother to child, if a mother during pregnancy contracts a particular kind of viral infection like herpes or like measles, it could be that the baby gets infected as well. Indirect contact by fomite would be something like stepping on a nail. A fomite is an inanimate object. It could be dirty tissues, something on a doorknob. And droplet transmission would be the fine aerosol that is emerged or emitted from someone's upper respiratory tract when they sneeze or cough. So contact transmission, a wide variety of ways of transferring a pathogenic organism from either another person, a fomite, or in an aerosol spray. Vector transmission we've already mentioned in terms of mode of transmission. Mechanical transmission, which would be an insect that has the pathogen on its outer surface, and a biological vector, which would be an insect that bites you. Both types of biological vectors and mechanical vectors can transmit very different types of pathogens, all of which can make you very ill. Vehicle transmission would include water, air, and food. In addition to water, air, and food, we could even include things like injectables, IV solutions, essentially anything else that is not a person for contact transmission or an insect for vector transmission. How do we prevent and control disease in our own home? There are various things that we can do to prevent the mode of transmission from occurring of a pathogen from whatever the reservoir is or the source to us. And the easiest thing that we can do in our homes and in our everyday lives is hand washing. Good, appropriate, proper hand washing cannot be surpassed as a mechanism or a means of breaking or preventing transmission of unwanted, transient pathogenic organisms. Removal of pathogens from food and water. Processes like pasteurization assure us that we're going to have good, reliable sources of food that don't make us sick. Vector control, where we're essentially keeping insects out and us in. Quarantine and isolation of individuals at risk. Occasionally, quarantine is not appropriate for certain types of diseases, but in some cases, when a disease is strictly something that's contagious or communicable, person to person, then quarantine would be an appropriate type of control mechanism. Conferring immunity, either actively with immunization or passively by transferring immune factors from one person or one source to the patient. Maternal antibodies from mother to child during pregnancy, or manufactured antibodies to counteract the effect of toxins, such as antitoxins used to inhibit the activity of things like tetanus or botulinum toxin. These are all ways of preventing or breaking the mode of transmission and limiting or preventing diseases from occurring. Sometimes we have to put patients in quarantine or isolation, and if we do so, they might need to be essentially isolated even from the healthcare providers. In that case, the healthcare provider needs to wear some kind of personal protective equipment, often gown, mask, gloves, some combination of the three, and the appropriate signage on the patient's door to alert anyone that's going to be working with the patient that they might need to take precautions and make certain that they don't get exposed to the disease organism. If it's a fine mist airborne type of pathogen, then frequently, especially if you're going to be within a meter of the patient's blood or body fluid splash, you'd need to wear a gown, an N95 mask, as well as gloves. Large drops that fall within a meter would be the criteria for droplet isolation. And again, you'd want gown, eye shield protection, and gloves. For contact, we're only worried so much about microbes on surfaces so that we have no contact transmission. We make sure that hands and surfaces are always kept clean. Make sure we wear a glove and gown. But we don't have to worry about airborne transmission if it's simply a contact type. And if it's contact with droplet, then we for certain at all times want to wear all of the PPE required: gown, mask, and gloves.